Flanked by the leads of the National Institute of Health and Federal Drug Administration,
I couldn't be more pleased.
Health and Human Services Secretary Robert Kennedy announced the CDC would no longer recommend COVID vaccines for healthy children or pregnant women.
Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy.
The announcement circumvented normal CDC vaccine procedure and blindsided health experts like former Ohio Academy of Pediatrics president Chris Peltier.
Very unusual and a little worrisome.
We wanted to know what you thought about the change, so we asked. Our post on Facebook garnered more than 100 responses in 15 minutes, nearly 500 an hour. Comment after comment, largely rejecting the vaccine.
The vast majority of responses were a straight no. Does that concern you?
It does.
Peltier says pregnant women are still high risk for severe complications from the coronavirus, and while young children are less likely to get seriously ill,
that doesn't mean that young children don't get COVID, that they're not going to get hospitalized, and that they don't die.
How do the so-called experts, whatever you might call them, win back the trust of that portion of the population? Is it possible?
That's a great question. And I think, unfortunately, we can't predict the future. And I don't know. I think what we have to do, though, as pediatricians, as healthcare providers, is continuing to talk about what the evidence shows.
Peltier says that evidence continues to show vaccines are safe and effective at preventing severe disease. But the most important thing to do is, if you have questions, is to ask your doctor what they think. Sean Delancey, WCPO 9 News.